Hello, everyone. I'm Jen Lee. I'm the Deputy Director at the Association of Asian Pacific Community Health Organizations, or APCHO, and it's my pleasure to welcome you to day 2 of this inaugural TB Summit. We're truly excited to continue on this second day with more wonderful guest speakers and opportunities for you to engage with colleagues and experts. Before we get started today, we have a couple brief reminders for you. So first, we want to just encourage you to engage with our poster presenters and exhibitors who were with us yesterday. This wonderful summit platform will allow you to message these presenters directly, and you can even set up a one-on-one meeting through the platform. The other thing we wanted to remind you of is we're really lucky to have our partners with us from the TB Centers of Excellence. So they are offering some really great training resources and opportunities. So you can visit them and chat them directly to learn more about these wonderful resources. Really want to take advantage of the great support that they have accessible to you. And you can also check our event feed for additional opportunities that'll be posted there as well. With that, thank you. And my next step, I have the pleasure of introducing one of our long-term colleagues and partner, Kathy Cochin. After 11 years as president and CEO of the Asian and Pacific Islander American Health Forum, Kathy has stepped into the role of executive counselor to the board. The Health Forum is a national health justice organization that influences policy, mobilizes communities, and strengthens organizations to improve the health of Asian Americans, Native Hawaiians, and Pacific Islanders. Kathy is a renowned voice in the Asian American community and formerly served on President Obama's Advisory Commission on AAPIs. She also serves on multiple boards in her community service, including currently she's a trustee at the Tresky Foundation, Asian Women's Shelter, Compass Point, the Public Health Institute, and the California Pan-Ethnic Health Network. We want to welcome Kathy with us today and to take us to the next part of the session. Thanks, Kathy.
Thank you so much, Jen, for that really warm welcome. And Jen and I have known each other for so long, so it's really wonderful to be together on this platform with all of you. On behalf of the Board of Directors and the staff at the Asian and Pacific Island American Health Forum, I want to bring you our greetings and welcome to day 2 of this inaugural TB Summit. We have been so honored to partner with APCHO, the Hepatitis B Foundation, and Stop TB USA to launch the TB Community Engagement Network. With the critical support of the CDC, the entire initiative is focused on eliminating TB among Asian Americans, Native Hawaiians, and Pacific Islanders at risk. With the disproportionate rate of TB among AAs and NHPIs, the TB Community Engagement Network is an important effort by community partners across the country to reach underserved AA and NHPI communities most affected by TB. We are a proud partner with the 14 inaugural members of the network, many of whom we've worked with for over the last 20 years, as well as with the new 10 grantees who are working on awareness and building provider capacity on latent TB infection and TB testing and treatment. It's been a privilege to be a partner with APCHO, Hep B Foundation, and Stop TB USA to co-lead this national response. We've been inspired by the model of Hep B United and how we've appreciated CDC's support and vision in this innovative network. We also want to thank Nicholas DeLuca, Leanna Allen, and the whole TB team for their willingness to be innovative and creative and to help really partner with those of us in the community to really do this important work. I also want to acknowledge Dr. LoBue and the leadership in TB at CDC because they have recognized the importance of new partnerships to eliminate TB. We especially appreciate the understanding and recognition of how important community-based partners are in this effort. For without the trusted community organizations on the ground, the key learnings and messages would otherwise go unheeded. So it's important that Dr. LoBue understands that the network will raise awareness and promote latent TB infection testing and treatment, as well as engage healthcare providers. For the Health Forum, it has been our privilege to partner with the Center for HIV/AIDS, Hepatitis, STD, and TB for over 25 years. For these 2.5 decades, The Health Forum has become a relied upon partner to CDC for public health response at the national level, especially for AN and HPI communities across the country and across the Pacific, including US affiliated jurisdictions. We continue to be very proud of our role as a leading partner with CDC, not only for HIV and AIDS and TB, but also for COVID-19, in which APCHO is also an essential partner. Thank you to the CDC for your ongoing support and continued investment in health disparities facing Asian American, Native Hawaiian, and Pacific Islander communities. This commitment and investment is all the more critical in this moment of pandemic, where anti-Asian hate and stigma, as well as the disproportionate impact of COVID infection mortality, so significantly affects Native Hawaiians and Pacific Islander communities across the country. Now, let me formally introduce Dr. LoBue. Dr. Philip LoBue received his undergraduate and medical degrees from the University of Pennsylvania. He did his medical training at UC San Diego, where he was later an assistant professor. In 1999, Dr. LoBue joined the Division of TB Elimination as a medical epidemiologist assigned in San Diego County. In 2004, he moved to the CDC headquarters in Atlanta and has been in the leadership at the division ever since. Dr. LoBue has chaired or served on more than 10 different guidelines and recommendations committees and panels for multiple organizations, including the CDC, the US Federal TB Task Force, and the WHO. It is my honor and privilege to introduce Dr. Philip LoBue.
Good afternoon, and thank you very much for this gracious invitation to speak today. If I could please have my first slide.
Oh, hello, Dr. LoBue. Sorry, this is Joe Lee. We will be sharing your slides momentarily.
Okay.
And it looks like, Evelyn, you have pulled it up. So if you can share your screen, that would be wonderful. Thank you. Okay, here we go.
Okay.
Thank you very much.
Thank you. Thank you very much. Next slide, please. So I'm going to start by briefly talking about the Division of TB Elimination at CDC at the high level. Our mission is, as our name says, to eliminate tuberculosis in the United States. That is defined as a case rate less than 1 case per million population annually. And our vision is to promote health and quality of life by preventing, controlling, and eventually eliminating TB in the United States. Our guiding principles, we want to give priority to cost-effective and scalable programs, policies, and research that will have the greatest impact on achieving our goals. And the 3 really overriding goals here are, number 1, to reduce the incidence of TB infections and subsequently TB disease, lower TB morbidity and mortality, and very importantly, which is really relevant to what I'm going to talk about today, reduce health disparities. Next slide, please. On the positive side, we've definitely had some success over the last couple of decades. TB, after a long decline going back to the 1950s, we had a resurgence of TB in the late 1980s and early 90s with a peak of just under 27,000 TB cases in the US and a case rate of 10.4 per 100,000 in 1992. And then since that time, we've had a fairly steady decline, reducing the number of TB cases to just under 9,000 and the case rate to 2.7 per 100,000. However, that case rate is well above the goal, the elimination threshold, which is less than 1 case per million, as I said, which would be about only 330 cases in the entire country. And it's also, if you look at this graph, you'll notice toward at the end that line is flattening. So our rate of progress has been slowing. Next slide, please. And as I mentioned, the importance of disparities, and this graph really illustrates the disparities, in particular disparities related to the Asian American community. The graph shows the case rate of TB per 100,000 persons over time, and each line represents a different racial and ethnic group. And as you can see, the gray line and the kind of dark teal line at the top, the case rates among Asian Americans and Native Hawaiian, other Pacific Islanders are much higher, even substantially higher than other minority groups, including African Americans and Hispanic Americans. So this is really important to us, in addition just to reducing TB overall, is to address this really glaring disparity. Next slide, please. And among US-born persons, among the US population, the other really major disparity is the amount of TB among persons born in the US, which is substantially lower than that among persons born outside the US. And in terms of Asian Americans, if you look at these two graphs, which show the percentage of cases by race and ethnicity for both non-US born persons and US born persons, you can see that there is a particularly high amount of TB among Asian Americans who are born outside the United States. As I said, in general, there's more TB among persons born outside the US simply because to get TB, you have to be exposed to someone else with TB. It's transmitted person to person. And TB rates are higher in almost every country in the world than the US. And so your likelihood of being exposed is greater if you were born, live, or spend substantial amounts of time in countries which have higher TB rates, which, as I said, pretty much any country outside of the United States. Next slide, please. But something that people don't often realize is with tuberculosis, most people go through a stage where they have a latent infection, where they're not sick, but the organisms, the bacteria is still alive within them and can reactivate and make them sick in the future. And this could take years or even decades. And so on this slide, what it's showing is for TB cases among persons born outside the US, how many years they've been in the US before they get their TB. And the thing I want to point out is that if you look at years in the US going out to 10 to 19 years or greater than 20 years, those combined are 47% of cases. So what you're seeing is a lot of reactivation of TB among people who have been in the US for a long time and probably were infected in the distant past when they either lived or spent substantial amounts of time in countries outside the US where they got infected, came to the US, have lived here for a number of years, and then can still get TB as that organism goes from a latent stage to active stage years or decades after they've been in the United States. Next slide, please. So the one thing that we really stress is that in the United States, most of the TB that we're seeing is coming from reactivation of latent TB. And so the little under 9,000 TB cases that we saw in 2019 largely are coming from a pool of people who have latent TB and infected months to years to decades ago and then reactivate at some time in the future. And that pool of people is much higher. It's in the millions, somewhere probably between 10 and 13 million people in the US have latent TB. And that's where most of the future TB cases are going to come from in the United States. Next slide, please. So our approach really has to be dual. One is, yes, we need to make sure that people with TB disease are diagnosed and treated, and that their contacts are diagnosed and treated if they have infection or disease. But we also, if we want to eliminate TB, also have to have deal with the second part of this approach, which is to test people for latent TB if they're at risk, and if they do have latent TB, to give them treatment to prevent them from reactivating. Next slide, please. And so to close, this dual approach, number one, disease control, which most of us are familiar with, really the focus of the health department. They're the ones, they should be ensuring that people with TB are diagnosed and treated to completion and conduct contact investigations. But the second point, if we're going to eliminate TB, we have to get prevention. It really requires prevention. And this is where engagement with primary healthcare providers in the community is critical. We have to be able to increase testing and treatment for latent TB, and partnerships with community-based organizations are critical to facilitate that engagement. So I want to thank you very much and appreciate you giving me time to talk to the group today.
Thank you so much, Dr. LoBue. I know on behalf of the steering committee and all of us as partners, want to thank you for being with us here today and for the wonderful presentation. For those of you who are just joining us, welcome. Welcome to day 2 of the summit. This actually concludes kind of our opening session. And I'm going to ask you to, as a next step, you'll go ahead and head out to our sessions, which are on deck as our next part of the day. And thank you all so much again for joining us. And we hope you enjoy the next couple of hours with us.